Are you a Christian who has ever felt criticized or judged for taking medication for your mental health? And have you ever wondered, am I doing the right thing? Well, stay tuned because I've got some answers for you. Depression, anxiety, bipolar illness, psychotic disorders, personality disorders. We now know those things are genetic. And we understand the science behind them so much better than we did 20, 30 years ago. We can map a brain and see depression in a brain the way we can take an x-ray of a fracture in a femur and see that it is broken. So to tell somebody that they can't take medication or shouldn't take medication for something that's an actual medical diagnosis is really irresponsible. Imagine telling somebody with diabetes, you shouldn't take your insulin. You just need to pray more and trust God. Well, their blood sugar could go so high that they could have all kinds of problems as a result. They could go blind, they could go into a coma, they could lose some of the nerve feeling and function in their extremities. They could even die. And that's true of mental health, right? If you don't take your antidepressant, something really bad could happen. So the example that I often use with people is a personal example. Because mental illness is both nature and nurture, there's a genetic component, but there's also things that happen in the environment, trauma, stress, substance abuse, poor choices we make, our diet. So much of depression actually comes from not eating right sometimes. So because there's a nature nurture component to all mental illness, the example that I often use about whether or not a person should take medication, if I'm talking to a pastor and they're like, I don't really want this person to take antidepressants. I just think they should pray more or trust God more. This is the example I use. So I am technically legally blind in one eye, and I need corrective lenses to drive. I cannot see more than about 12 inches past my face. Now, some of that's genetic. Some of that is how I was born. I also had a horrible eye injury when I was about 2 years old that actually burned my cornea on one side. And I have read and probably engaged in too much screen time and not always eaten the right foods that I need to eat for good vision. So I can't see to drive without my corrective lenses. It's a nature and nurture problem. Now I asked the pastor or whoever I'm talking to at this point in the story, do you want me to get on the freeway after this and try to drive without my glasses? Just praying, just trusting God, just having faith. Well, of course not. That would be dangerous, not just to me, but to those around me. If you have been diagnosed with depression, anxiety, an adjustment disorder, something more serious, bipolar disorder, schizophrenia, another psychotic disorder, or a personality disorder, and you're wondering whether or not you should take your medication, you have a medical disorder that responds to a psychotropic medication. You doesn't mean you have to take it forever, but for this time, while you maybe get some coping strategies or you get through some bumps in the road, by all means, give yourself grace. Walk in the grace that God has already given you and give yourself permission to take good care of yourself, especially if that means taking your medication. I have some related videos to this, which I'll link below. Check out my video on what it means to be a person of faith with a diagnosis of one of these things we're talking about, depression, anxiety. Also check out my video on how The spiritual disciplines like prayer and meditation and even fasting can improve your mental health. Until next time, be well. May the Lord bless you and keep you.